Adam Feuerstein, I understand that Alzheimer's disease experts are gathering in your hometown of Boston next week to discuss emerging therapies for this absolutely horrible disease. I suspect Wall Street will be paying attention to that, but is there any reason for optimism?
Greg, not really at this point. Alzheimer's is a devastating disease, and it's made even worse by the lack of effective treatments. And the problem is growing worse as the country gets older and people become more susceptible to the disease.
I know that you've reported on several drugs recently from Johnny John, Eli Lilly, and AbbVie that have failed large late-stage trials. Will next week's conference be more of the same?
A lot of the time in next week's conference here in Boston is going to be spent reanalyzing the failed studies of Johnson & Johnson's bapineuzumab and AbbVie's Gamagard. Now, for those investors who remain optimistic, perhaps naively so, there will be a big focus on Eli Lilly's solanezumab. Now, this drug also failed to demonstrate a benefit in 2 large phase 3 studies last year, but Lilly insists that there was a signal of efficacy in patients with mild Alzheimer's. Now, to investigate this signal further, Lilly is planning to conduct a new large phase 3 study of solanezumab in these mild Alzheimer's patients, and the company is actually holding a conference call with investors on Friday to go over the details of the study.
Anything else noteworthy?
Merck has an Alzheimer's drug that's known as a beta secretase inhibitor. It's currently in a mid-stage study. We're not going to see results from the study at the conference next week, but the company will be presenting other related data. Now, this is important because development of a different beta secretase inhibitor from Lilly was discontinued last year due to safety concerns. Now, you can expect the Merck drug will get extra scrutiny at next week's conference because as investors try to determine whether the safety problems that killed the Lilly or whether they were a class effect that may affect the Merck drug.
All right. Thanks a lot, Adam.